When I was young, I used to picture my family as superheroes. I thought we were immune to every evil force, including disease. It was because I saw that we were healthy and happy. We lived in Canada with good food, fresh air, and one of the best healthcare systems in the world. No one in my family had a disease that I knew of. But as I grew older, I realized that we actually were not so invincible. Before I was born, my grandma had a blood clot in her brain that almost took her life. My grandpa has developed a heart disease in recent years. And since 2019, one of my closest relatives has suffered from a mysterious foot pain. The reality is diseases are inevitable. We will likely all get some sort of disease in our lives. They happen more often as we age and our body weakens. But it can even happen to healthy people, which is what we think we are while we are young, like my relative did. Because she felt healthy and active in her 40s, she didn't think much of the pain in her foot at first, until it unpredictably became more severe and took away the ability of her to walk. Unfortunately, we cannot predict when diseases will strike. But that does not mean we should just sit and wait for the disease to get us. Instead, I think we should be proactive, and we should learn to work to reduce the chance of developing an illness in the first place. This is called preventive healthcare, and I believe it has a lot of potential to meaningfully improve the quality of our lives. There are two types of preventive healthcare I want to introduce to you. The first is primary prevention, which involves healthy habits on the individual level. It ranges from regular exercise and sufficient sleep to weight and blood pressure management. A recent study from the International Journal of Preventive Cardiology shows that 70 to 90% of the cardiometabolic risks, those that cause heart disease, stroke, can be prevented through simple lifestyle modifications. This means if we engage in healthy habits regularly, we can significantly reduce the chance of developing chronic illness. The second type of prevention is secondary prevention, which involves screenings to detect a health issue before any symptoms arise. The most important screenings are for the most common types of cancer: breast, lung, cervical, and colon, all of which have been clinically proven to be effective by the National Cancer Institute. It is much more likely for a cancer to be cured if detected at an early stage. And the great thing about all of this is not only are there health benefits, but also financial benefits. In many cases, preventing a disease is much cheaper than treating it. A 2021 study from the Health Economics Review estimates that for every $1 investment that goes into prevention, $7 can be saved in future treatment. With preventive care, healthcare costs can be significantly lower for both individuals and the economy. But wait, you might just be thinking, doesn't all of this sound quite intuitive? Maybe. But many of us are actually unaware that small actions can have big consequences. Because my relative thought her young feet could handle it, she wore cheap shoes to exercise even after her foot pain started. My dad stays up for extra hours every night, which puts his body at risk for chronic diseases. In fact, millions of the people in the United States don't receive the recommended preventive services, such as vaccines. Recently, I also had the opportunity to talk to Dr. Roland Grad, interim co-chair at the Canadian Task Force on Preventive Healthcare. He explained that many Canadians don't know their options for screenings. So the next question is why? Well, why do we act like this? I think it is mainly because we are short-sighted. Many of us stay up night after night to watch our favorite TV series because we do not immediately feel the benefit of sleep on improving the long-term agility of our brain. It is common for us to convince ourselves It is okay to have unhealthy foods for just one more meal, because we do not see how extra fat can build up over time and clog our hearts, which is exactly what happened to my grandpa and his heart disease. We don't feel the effects of bad habits when we are young, so we don't take the effort to engage in prevention. In fact, many countries hold the same short-sighted mindset. Governments often don't invest enough in prevention because its long-term benefits usually happen beyond a politician's political cycle. In 2015 in the United States, the entire budget for all chronic disease prevention activities was merely $4 per citizen. Across Europe in 2014, governments only spent an average of 2.8% of their healthcare budgets on prevention. Inadequate funding has left rural populations without the resources to strengthen their health and created opportunities for communicable diseases to spread. But the thing is, if homeless shelters simply had better ventilation in the first place, or low-income families were able to build up their immune systems with better nutrition, populations may have been better able to fend off those diseases. And all of these problems have been compounded by COVID-19. More of us have been living lives with lots and lots of sitting, as school and work can now be conveniently done in front of our computers. And along with the avoidance and procrastination in going in for screenings, our health situation is not looking so good. So we have to take a step back and redefine our approach to healthcare. We have to focus more on preventive care. But in what way? After research and discussions with a couple of healthcare experts, I think there are a few things we can do. First, healthcare systems need to emphasize the importance of individual actions in healthcare. When we think of prevention in conventional medicine, convenient vaccines and drugs like aspirin often jump to our minds. We tend to be reliant on pharmaceuticals to protect our bodies because, well, they are high-tech after all, aren't they? But while they are important, they only defend us against specific types of diseases and do not holistically improve our bodies like daily habits do. In traditional Chinese medicine, which my family practices, daily individual habits are highly valued. For example, we like to drink chrysanthemum tea, which is known for preventing inflammation. My grandma practices Tai Chi daily, known for improving her overall bone strength. Like in traditional Chinese medicine, I believe we should engage in mindful nutrition and physical activity to strengthen our bodies. It would be helpful for doctors to remind us about it because people forget, and even create personalized healthy living plans for them. My relative did not receive this type of care, as her doctors only prescribed medicine for her to use. As a result, she could not find opportunities to exercise, and it left her physically weaker overall. Second, governments need to take leadership. They need to fund preventive care in order to improve the quality of preventive services. Part of this means using the resources to address awareness, because calls for prevention shouldn't only happen during a pandemic. People forget about vaccines and screenings all the time. Dr. Grad, the expert from Canada's task force who I mentioned earlier, suggested for Canadian provinces to offer constant reminders. He noted how in Quebec, reminders for breast cancer screening have been sent to women ages 50 and older. Thirdly, we need to take action on helping the most vulnerable. I also talked to Dr. Bruce Newbold, a professor on health and immigration at McMaster University. He explained that physicians often don't like to set up clinics in rural areas with fewer patients. As a result, it is typically families of lower socioeconomic status and minority cultures living in rural areas who don't have access to healthy living guidance or screenings. He mentioned that one way to address this problem is to direct services towards those people. This can look like bringing simple prostate screenings to people's homes, or setting up local seminars to strengthen knowledge about prevention. I also think a part of targeting must include targeting to different cultural groups. Canada is home to many immigrants, and different people understand preventive care differently. For example, Asians tend to stigmatize mental health. Many of my Asian friends have continuously complained about the stress they feel from balancing school and countless extracurriculars. We hesitate to talk about our health because if we do, our parents will just tell us we aren't hardworking enough. So physicians need to understand these cultural biases towards prevention so they can engage patients in preventive care that both respects their beliefs and benefits their health. But here's the most important thing you need to take away today. That is, what can you as individuals do on a daily basis to better your health? I think first, that starts with understanding that preventive care is important and remove any existing bias you might have. Prevention is for all of us, regardless of our age or how we look. Even if you are young and you appear to be skinny, just like how I was, you might be unprepared to fight communicable diseases like pneumonia, just like how I coughed a lot when I was younger. We all have different risks to diseases to learn about as they can come from our family or the environment, like if we live near an industrial area. For healthcare, it is important to follow facts and not intuition. So that means we should educate ourselves on the symptoms of the most common diseases. For example, you might not know how to recognize the early warning signs of melanoma, skin cancer. Or you might be like my relative, who did not know how to recognize the severity of her foot issue before it was too late. And I know you can do it because it isn't hard, especially with the rise in online resources. Medical databases provide information on the most effective preventive actions. Specifically, Canada's Task Force on Preventive Healthcare offers recommendations for screenings and vaccines to at-risk groups. Many of us are likely unclear of the specifics, age ranges in which we should get screenings and vaccines, which can make a significant difference in how early our issues are diagnosed. Finally, action must follow understanding. We must learn to live active lifestyles without technology to do everything for us. Find opportunities to get to places by walking, or even do your chores manually. Spend time outside because your lungs can benefit from fresh air. I know it can be hard to remember in your busy lives, but preventive care can be a collaborative effort. We should remind each other to keep up healthy habits, just like how I remind my dad to exercise while he's at work. At the end of the day, we are probably going to come across more and more diseases. New viruses could emerge every day. While we probably can't be superheroes who are immune to every disease, preventive care can make us stronger, both physically and mentally, to get us one step closer. So let's relearn how to enact small changes to better our health. Let's build strong and resilient communities against future diseases. Thank you.